So, have you ever heard the word overuse injury but didn't know what exactly it was? Well, my name is Dr. Heather, and I'm your virtual sports chiropractor. And that is something we don't really address that much. A lot of times we talk about the various different kind of ailments that we're experiencing, wondering how to fix them, but we don't really actually talk about what is an overuse injury. So, that's something I wanted to address real quick today, because I have a story to share with you. So, one of my very good friends and former telehealth patients, he actually messaged me out of the blue and said, "Hey, can I pick your brain about something?" And I said, "Of course, sure. Let's chat. What's going on?" So he talked about the fact that he's going to be embarking upon an incredible swim journey, one that is very labor intensive right now, where he's got to do over 2 hours of grueling swim per day just to start training for this event. Now, with that being said, he did inform me, yeah, he's got that disc herniation going on, but he's got some feeling like he's got a strain to his hip and to his groin area. And then also noticing that, on a side note, the leg discomfort that he's feeling, kind of associated with that disc herniation, is not really going away. So he actually proposed the question and asked, could it be an overuse injury? And most certainly it could. So that is something I wanted to really kind of focus on with you guys, is really kind of give you a better understanding of what is an overuse injury. So I'm going to actually make this a little bit bigger on the screen so you guys can see. So, this is what the Mayo Clinic really describes an overuse injury as, and as you can see, it can lead to a very serious injury known as a stress fracture. And that's something I think, especially in my running community, we all fear. We don't want to embark. We don't want to actually wind up noticing that we get that stress fracture. So what does that mean? Okay, well, two things usually we look at when we talk about overuse injuries. One is obviously something happened with our training or something happened with our technique. Now, when we look at the training error, we're looking at, doing things kind of too quickly. So this is something, when people talk about really kind of getting more like, say, a shin splint setting in, usually a lot of times it's because that is an overuse injury, due to the fact that we're starting to kind of increase our mileage, our distance, our duration too fast, too quick. So what's happening is obviously we're putting more strain, load on the joints, on the muscles, and our body responds by creating an inflammation process, which can then lead to that overuse injury. Now, the other thing is technique. You could be starting to do something that actually is going to set in some compensation patterns that's going to lead to that injury. So like I said, this is what the Mayo Clinic really states, is that, what is that definition of an overuse injury? So like I said, for those that are still kind of complaining about shin splints, maybe also too noticing that their hips are really tight, maybe having more low back discomfort, post-run or post-activity, you do want to address the fact, is it an overuse injury? Now, if you guys are wondering, well, how do I know, Dr. Heather, if I have an overuse injury? This is something I've always said to you guys: book a free consult with me. There's no charge, there's no obligation, but it's a chance for us to kind of really meet and see what's going on. Because the one thing I want to make sure that you guys understand is that in order to prevent an overuse injury from occurring, we want to really look at our muscle balances. So, if you're somebody who is just taking upon, going out and starting to run, you're really enjoying it, and you've got a whole slew of races coming up and events, and, you don't really kind of know what your muscle imbalances are, what those weaknesses are. When we go through that consult, one of the things I will do with you guys is actually go through what's called a functional movement screening. It's very simple, very easy to do, and we can do it, via, video, along with a gait analysis, because what that starts to tell us is really looking at the muscle firing patterns and how our body is moving for that particular activity or sport. So now with my friend, because he's doing more of a swimming event, I'm more curious to know, well, is he actually creating more hyperextension while swimming? Meaning he's engaging his low back a lot more than actually his lats, or utilizing his subscapularis muscle, which he would need for the stroke movement in swimming, along with the fact that his glutes might not be firing, because if I remember correctly, when I worked with him for his longer run event, he did have some external rotation on the right in terms of his hips. So we already knew that he was kind of presetting, a pattern that was going to always engage his piriformis, So we want to look at addressing that first. So when you're looking at your events throughout the year, it's really important to understand, what are my muscle weaknesses? What are my challenges? How do I utilize strength training, corrective exercise, and a little bit of rehabilitation to help head off any injuries that I might be encountering throughout the entire year? And like I said, if this is something that you want to kind of go into further, if you're not sure if you really are suffering from an overuse injury, I would recommend book the consult. Like I said, there's no obligation. This is a chance for you to gain some real insight, talk to a professional, me, your virtual sports chiropractor, and let me help you figure out what needs to happen next. There's a lot of great tools and resources out there made available to everyone, but sometimes we just don't know how to put those all into perspective. So like I said, guys, that is what an overuse injury is. And when we want to look at really kind of making sure that we're not creating an overuse injury, we do want to look at our muscle imbalances and firing patterns, so we have a better understanding of what muscle groups should really be working when we're trying to perform our actual activity or sport. Again, guys, this is Dr. Heather, your virtual sports chiropractor, and today all we did was really kind of just address what an overuse injury is.